Call the Board of Health meeting to order for the 18th of April. And our first item on our agenda is approval of minutes from March 21st meeting. If we got a chance to look at those.
I didn't see anything.
I did not, unfortunately. I was here. But you guys didn't meet last week?
Yeah, didn't we not?
No, 2 weeks ago.
Oh, okay.
Oh, wait, no, it was so
This
March
was the
21st.
meeting prior, this was,
Yeah.
we didn't have a quorum our last meeting.
Oh, right.
So this was our in-person meeting.
I looked through them earlier, but I didn't see anything offhand. Anybody have any comments on them? Did you go through them?
I didn't find anything. So,
If there wasn't anything we found, may I hear a motion regarding the March 21st meeting minutes.
make a motion. The Board of Health approves the minutes as is.
Right. Motion made, do you hear a second?
Second?
Motion made and seconded. Any other comments? And vote, Mona?
Aye?
Stefan?
Aye.
And I. So 3-0-0, meeting minutes are approved. Next on our agenda, 7:35, septic local upgrade for 2 Millbrook Avenue.
So we have Pat, who's the design engineer for the plan.
Pat, if you wouldn't mind, just state your name for the record, full name.
I am Patrick Burke, civil engineer at Places Associates, representing the applicant.
Pat.
Best place to set this up.
Yeah, that's fine right there.
Yep, thank you.
Do we have that? Do you want to do the electronic board, or is it easier? What's easier for you?
So I don't have the plan
Okay.
electronically pulled up. That's just the application for the
Okay.
approval. I do have a copy of the plan if anyone wants to look at it.
You guys
up
are okay to
close.
see? You can see it from up there?
Yeah.
We're good.
So we've got a 4-bedroom, single-family home, 2 Little Millbrook Ave. Septic failed, it was tested because the house has been sold. We had originally done testing up in this area, and had less than 2 minutes an inch with groundwater greater than 10 feet. Proposed design, which was approved with condition that we retest in the area of the system. When we went out, we tested in the lower area on the lot, and got groundwater modeling around 50 inches. And we got a system that is perfect, so a little different soils and much different groundwater elevation. That required a redesign of the system. We came up with the trench and pipe system that you see here. The house is here, there's a shed here, concrete driveway here. When we did the groundwater, the separation of groundwater was 4 feet. That would require a pump system. When it comes from the house, just to pump it up probably a little bit less than a foot. And a lot of breakout in the area, a lot more greater than we're showing. What we're doing, we're requesting a local upgrade approval to reduce the separation of groundwater from 4 feet to 3 feet. That would allow us to avoid the pump system and a lot less disturbance in the area here.
I'm sorry, I think I might have missed it. Was it failed system you're?
Yes,
Okay.
failed system, yes.
So are the previous owners taking care of that, or the new owners?
I'm not quite sure.
Previous owners are saying.
The previous, oh, okay.
These are the,
This is the present owner.
Oh, okay. Otherwise, they can't sell the house, right?
no.
So what's the state regulation in this regard? Is that,
So normally with a 6-minute per inch perk, you need a 4-foot groundwater separation. However, Title V does allow the local upgrade approval for the, to go from 4 to the 3-foot. Granted that the certain criteria is met, which all of this is being met, as far as it's a failed system, it's a repair, it's not new construction. There's no reduction in the field size, there's no setback reductions. So it is meeting everything that Title V allows to be able to have this variance.
any concerns at all?
No, still pending some revisions, but no concerns as far as.
Okay. Other questions? I want to make a motion. I'll make a motion then regarding the 2 Millbrook Avenue septic local upgrade approval. The Board of Health moved to pass the request for the 3-foot separation versus the 4-foot separation, knowing that we've met the other criteria of Title V, failed system repairs and such. So I think we were okay to approve that. Do I hear a second?
I'll second.
Okay, any other comments? Okay, motion been made and seconded. And we'll take a vote. Mona?
Aye.
Stefan?
Aye.
I also. 3-0-0. Thank you. Good luck, guys.
Yeah.
All right. Next on our agenda was the lifeguard variance for the Education Cooperative.
So this is a variance that we've seen in the past. It's to allow for the tech cooperative pool to not have a lifeguard, on staff when they're in the pool. So under the criteria that, there's at least a 1-to-2 staff to student ratio. There's a minimum of 1 CPR first aid certified, staff member at the pool at all times. There's no more than 12 individuals at the pool at any time. They have 4 nurses daily on staff, and they have one of them at least in the pool vicinity while it's in use. The pool water is tested 4 times a day to make sure that chemicals are being met, as well as the CPO is following through by being on site, and they're required as well. And then they say the pool is outfitted with a camera system, and then there is an AED in the pool. All staff are CPR first aid trained annually. The pool is locked 24/7. And then the signage in the pool, so no lifeguard on duty, no entry without staff present, no children under the age of 16 without an adult being present. Adults should not swim alone, no alcohol, and no alcohol shall be allowed to swim, or no consuming alcohol while swimming. And then just for reference, this is the motion that was made last year. Jody, are you guys all set? Can I move it closer for you to see?
No, we have it, thank
Oh,
you.
you have it, okay, good.
I have it, I know. Okay. But in no incidents in the past year at all, right?
No,
Okay.
and I was out there 2 weeks ago at this point to do chemical testing. Chemicals looked good, CPO was on site at that time, and everything was good.
Okay.
I know we did a few different pool variances. Was there something that we had, was it AED? I remember we made, recommended some verbiage. Was it the AED that we had asked about as kind
Yeah,
of
I
like
think-
our standard wording, which I know they already.
Was there a certain staff?
That was last
member
year,
or
yeah, we
something?
did that, at least 1 AED to be obtained and
Okay.
maintained in close proximity to the pool, and then I think last year it was the addition of someone on staff, is CPR first aid and AED certified during all hours the pool is open.
Yeah.
Which these
Which we
nurses
use
have.
this, yeah.
Okay, good.
So, I mean, I think it's just the language that's in here, because it says CPR and first aid. There is a differentiation between the different types of training that you can get. You can get just first aid, you can get just CPR, and then you can just eliminate AED altogether as part of your training. So I think it's important that we do call out that people are trained specifically in how to use an AED.
Is it the second?
Especially in a
bullet
pool. A pool is a very dangerous location to be using an AED.
Right.
down? Do we capture that on the second
You
bullet,
wanna
second
have
to last bullet? Does that
AED in
seem
it.
right?
Oh, it is, yep.
It is.
That's interesting.
Okay.
Is it
And then they
mentioned-
obviously would be required to fill out the indemnification form.
Am I looking at a different one? Or is that the motion? I'm looking at their
that last year's?
letter
Do
to
you want to move
us.
it closer, or?
No, I,
Last year's motion, is what I gave the board, but that does the second to last bullet proof, it breaks down CPR first aid and AED.
oh, it says the education cooperative in the top.
Oh, so this is the letter we sent
Okay,
them, as this is the motion, and we let, the letter we sent them containing the motion in it.
oh,
That
okay, I
was the
see.
minutes.
Yeah,
And so when
this
you-
was like the bulk of what that motion was.
Yeah, so when you look at their additional safety measures that are in place, they don't mention the AED portion of their training.
In the new one?
In their
In their
request.
letter to
In their
us,
request.
that right there, the request.
But
Okay.
there is, right?
In our motion,
AED located in the pool area.
so that's
there's
what I'm
no
looking at.
AED.
Yeah.
First
So
aid,
just as
CPR,
the
AED
CPR
trainings.
first aid, so there's no
You have to
mention
add
of-
AED.
Oh, there is an
I was
AED
just reading
worker.
that, that's why I was mentioning it,
Yeah.
but.
Isn't that part of the CPR training though now these
No.
days?
But it's-
No,
It
it's
should
it's
be.
completely.
It could be,
yeah,
you can just
separate.
get CPR training and forget
Yeah.
about first aid.
Because I haven't had one CPR class without AED training.
You're medical, that's probably why.
So easy
I
use.
think that now it's part of the class, I don't know.
Not always.
Yeah.
So we can confirm.
Yeah.
Just
probably
have them,
Yeah.
we'll make a motion as part of whoever wants to make the
I know at
motion,
my
maybe just have them
hospital, we all
include
had
that
to get
actual,
shot,
if
yeah.
they're so inclined to use the wording that we gave them and just
Yeah.
include that in their
You should.
documentation.
Yeah, because when you use an AED specifically at a pool, there's additional steps you have to take. Like, make sure you
No
dry the
water.
person off, no water on the person.
Yeah,
Makes sense.
Especially if you lay the person in a puddle, like,
yeah.
you gotta be careful.
It's gonna be worse.
What bad things can happen?
That's a good point.
We want to make a motion regarding the lifeguard variance request?
I will make a motion, in regards to the lifeguard variance, the education cooperative. Board of Health grants the education coop a variance, from our regulation requiring a lifeguard based on past season's good performance with all pool regulations. Also, we would like them to keep in mind that the variance will expire on May 31st of each year and must be renewed and voted on by the Walpole Board of Health each year thereafter. Also, they must give the Board of Health a written agreement to indemnify and hold harmless the town and individual members of the Board of Health from claims of any incident or accident in the pool area. And it shall be signed by the operator of the pool, a trustee or agent. The following conditions apply, though, again, the variance expires at the end of the pool season. They must provide the appropriate safety and first aid equipments and show a proof of AD training. And there must be, they should post warning signs in a conspicuous location. What else?
You have them follow the conditions that were presented in last year's approval. That should capture the rest of it.
Did we ever capture how they maintain the AED? What happens to it, like, over off-season? Do they inspect it? Do they
Would hope
maintain
that's
it?
part
I
of
mean,
their
Are they
inspection
supposed to,
system.
someone's?
Yeah.
There is a requirement, but
Yeah, there's-
an easy way to say it is just to maintain it in accordance with
There should.
manufacturer recommendations.
Because I know in our office, there's a company that comes up every year. What? Yeah, every
If
year.
they're not
Well, it
maintaining it,
depends.
what's
They
the
have to have
point?
it checked once a year.
Yeah, I know in the office, like in our healthcare office, like once a year, a company comes out, they service it, so it's good for 1 year, but
Batteries, pads,
Oh,
all
But
that.
Yeah.
You gotta make sure
Yeah.
that
When they-
the defibrillator pads are up.
and like there's a light that blinks
Being
and stuff
maintained
like
according to
that.
manufacturer's
And
recommendations.
just make sure they maintain the
Yeah, that's,
defibrillator.
yeah.
Okay.
Identification, wording, and any other, do we hear a second?
A second?
Okay. Can we also, not to go back too far, can we have them, can we request them to update their application paperwork to mirror the AED verbiage and the conditions that we had presented? Because I know that's part of their application, the slight differences, as Stefan noted. Okay. Having said that, motion made, second and amended. Do we have a vote? Mona?
Aye.
Stefan?
Aye.
And I also. So we will grant that variance. Granted, hopefully everything is submitted as needed. indemnification and so forth. All right, thank you. Last on our agenda, 7:45, Planning Board, revised definitive subdivisions, the 965 West Street, Bruin Court, which I know we've seen a couple of times, right?
Yeah, so, this is the one that the representatives actually, they came a couple meetings back, just to clarify, that there's no construction going on. So this is it's the subdivision, but it's really his property that he's, extending. So the revisions were very minor. They had to label on the plan that it's a private driveway. They had some labeling of the utilities that were, minor changes. But the representative did reach out to us to clarify that, the revisions were minor based on the town engineer comments, and the plan for no construction remains. There's no changes in that.
Okay.
Do we make a condition? Not, because we haven't seen anything. Do we say in the court or
Yeah, we would say the same thing based on,
drawings that we
Yeah.
previously saw?
yeah, there's the changes, we're not,
It's all
we're not
strange.
objection to the changes, just reiterating the fact that this is all based on the no construction being performed in the wetlands
For now.
at this time. But then we'll have to see this multiple times if they ever decide to do anything in that area. This kind of helps us in the long run too, because it does break it up, so
If they'd ever do anything in the future, we'd see it again.
they're forced to do it the right way.
Yeah.
Yeah. You want to make a motion?
I can make a motion. In regards to Bruin Court, 965 West Street, the board has no additional comments or concerns, and this is an approval. And the board approves the changes that were presented to the board, under the assumption that there is no construction being performed in the wetlands, in accordance with the drawings that we saw at our previous meeting.
I'll second it.
Motion made and seconded, and then we will vote. Mona?
Aye.
Stefan?
Aye?
I also. So give that a pass. Yeah, it's really just the requesting comments, so you had no additional comments, so you can definitely hit that piece. Okay. Anything else we had? I know we have animal inspector nominations. Do we have any other?
So I just left that on there, because I know a few members weren't present at the last meeting, but just to reiterate, we still have the collaboration with the town of Norwood. John Spillane obviously retired after a long tenure here, so we had, Henry and Brianna, so they've been working with us over the last year, so they just want to be reappointed. So the reappointment process takes place every April. So we send the paperwork into MDR, and then we'll hear back. So the paperwork was submitted, so I should hear back shortly, but since I've been here, they haven't really turned down anyone, and especially with their long year tenure. But just wanted to fill the board in on that. We do have Household Hazardous Waste Day, May 6th, from 9 to noon. If anyone's interested in attending or helping out, if you have any questions, let me know. It is widely advertised. The police are aware of it. We advertise it on cable, the newspaper, posting on social media, but if anyone has any questions, we're your office to ask. Rain Barrel Program, I know you probably remember, we've had it in the past through the Great American Rain Barrel. They're based in Hyde Park. We are doing it again this year. Typically, residents can order through the month of May, and then there's a drop date in May. They're so far behind, and they're very lacking in the employees that they have. So actually, they won't do our drop until July. It's going to be July 11th. So if anyone's interested in purchasing them, they can go right on our website. The link's right there. You get them for a discounted rate. And then on July, they'll close the order July 2nd, and then they'll drop them off in Town Hall on July 11th. So if anyone's interested, if you can't make that date or you think of it afterwards, they do honor that price year round. It's just that you would have to go to Hyde Park to pick it up. And all of that information is on our website as well. And then lastly, it is starting to be mosquito season. So Norfolk County Mosquito is beginning their aerial spraying this week. Weather dependent, more than likely will be on Thursday. So they hit all the wetlands with the larvicide. and they'll go from there, obviously. A lot of people are probably aware, they do the tire program as well. Sometimes they do suspend it during their busy season, but they do take tires free of charge from your home, because obviously that is a breeding for mosquitoes if water's just sitting in there. And then they also do ground spraying. So you can go on the Norfolk County Mosquito website, and it actually shows where your area is, and what day of the week they'll spray, and you just call them. It's a little early right now to do it. That probably wouldn't take place until late May, weather permitting, but I'll keep the board posted with that.
And it's maximum 10 tires per household.
You've done it, yes.
I know that because I had them collect like 4 tires from my house.
Yeah, it is good. I just know their resources are spread thin, so during peak mosquito season, they sometimes will stop that program, and then obviously they'll pick it back up. But it is a good program for
Yeah, I
them
just
to
called them
offer.
the other day, because I live right across from a wetland, and they're usually very good, like, they come every year, and then they come back again in June, July, and spray the area, but they check the larvae, like, during this time of the year.
Yeah, we're very fortunate to be a part of the collaboration, because there's a lot of communities that don't have like a mosquito coalition, so it's super important, and it's nice because they're right in Walpole, so you can go there, visit them. It's actually, Megan, you did it right when you were an intern.
Yeah.
I had Megan go down. Yeah, you went too, Brenda.
Yeah.
It's really interesting.
Cool.
They check all the
It
wetland.
really is interesting.
Samples didn't find them?
Yeah.
So
All the
that's, you can
different
always
things
call,
and
but that's where they
it's
start
amazing.
with the aerial spraying, is all of the
I
wetlands. They
think
target
so.
all the wetlands.
Yeah, because, like,
Oh,
you
I
know,
I mean, it's am-
Yeah.
they have it on, because they never told me, like, we.
And they have all the
It's
maps, so they can
level.
confirm for you, you
So
know what I
you
mean?
know what
Right,
he's
yeah.
saying.
Yeah, they can tell from the
Yeah.
address, probably.
It's a great.
Yeah, so that's all I have. I know Mona had mentioned the upcoming meeting schedule. if
Okay.
The board wants
Do we
to
have
discuss.
board? I know there was the board member.
So
what's
the
schedule?
last board member will be sworn in or be appointed at the last select board meeting this month. So that is, I believe, the 25th of April. So our May 2nd meeting would be the first meeting we would have a 5-member board present.
Good.
Obviously,
We'll
depending
have
if people
someone, so Richard is not.
Yeah, Richard did not re-up his appointment, correct?
Do we know who applied?
We do, yes, yeah. So both Danielle and Brenda applied, yeah.
Good.
So the board will, appoint someone at the select board's next meeting, yeah.
Great, cool. Thank you guys.
So
very
hopefully it
much.
will take the pressure off of the remaining 3 board members, because, well, 4, I guess you'd say, because I know it's been tough with, if you miss a meeting, it's hard to make a quorum, so.
Is everything okay with Rachel, though? 'Cause
Yeah.
this is-
Yeah, I haven't heard anything. So, yeah.
Oh, I hope she's okay.
I know.
School vacation week, they might be somewhere good.
At least like shoot a text, because, you know, not always we have a quorum, especially with Stefan's wife, like having a
Yeah.
baby, you know.
Yeah,
Thank you for coming today, Stefan.
I know, it's tough.
Thank
Get
you
out
for
of the
that.
house, he's excited.
If it was not 7, I would definitely not be making it tonight. But yeah,
So our next meeting is scheduled for May 2nd, and it's a virtual meeting.
Yep.
It's a virtual.
It's a virtual meeting.
Right. So I'm gonna be at the airport, unless they, my flight is at 6:40, unless they got it delayed.
Perfect.
So probably not the May 2nd, but if the May 16 is a Zoom meeting, I can.
It's up to the board if you want to make the decision now, or if you want to wait till the
Can-
second, or if you just want to.
Plan on being virtual for both of them, if that helps, that allows you to do it. I have no
Mhm.
problem with that.
Yeah,
Yep.
if-
It's easy enough rather than.
Yeah.
than-
okay, awesome.
Yeah.
Perfect.
So the next 2 are virtual.
So,
Both are May.
Perfect.
so
meetings.
May's.
May 2nd and then May 16th.
Cool.
And I'm sorry about tonight, I got behind the truck.
Yep, what's that? I'm sorry?
I got behind the truck all the way down 27. I'm like, come on.
Okay.
does Norfolk County mosquito, do they let people just come down and visit them, or is
You
it-
can, I was gonna say, I can always give you, Dave Lawson, who's the director, I can always give you his contact information, but especially being a Board of Health
Yeah.
member, I think they would definitely welcome
Has
that.
anyone else on the board gone down there before?
No.
Done what?
The Norfolk County mosquito?
Like, if we visited them?
Like, go and visit.
No, never. I
It's,
never.
it's very interesting. So every time I have a summer intern, I always have them take a field trip down there. I think it's really fascinating.
I always
talk to them on the
How much time is it to?
I mean, it can be as long or as short as you want it to be. He could probably condense it to like a half hour, you know what I mean?
I mean, it'd just be good maybe for like an informational session for
Yeah.
the board.
Oh,
like
yeah.
a field trip or
We
something.
know what they do, really know
Yeah.
what they do.
Oh, yeah, I think that'd be great.
When I interviewed him, he was so excited.
Yeah.
Like I didn't, when I did my doctorate internship, I interviewed different people in town. And he was like, oh, wait a minute, get my picture just.
Yeah, he's very passionate about what he does.
It was so
Yeah.
good. And he went, make sure you get this in there, and I sent it to him, and he sent it back, and he was just really excited about having it in there.
Yeah, and I think a lot of people just don't really know
No.
that they exist and like the great work that they do, you know?
And they're very
Towns don't
reliable.
talk it out
Yeah.
either, but we don't.
Yeah.
We just write one little
Road
word.
trip?
Yeah, we should do a road trip.
Yeah.
I'll reach out to Dave. I'll reach out to Dave as early as tomorrow and say, when could he accommodate?
Yeah, I'd
Yeah, if
love
it's,
that. That would be
And
awesome.
it's a
Would be
nice
good.
trip.
That'd be awesome.
Perfect.
Cool.
They used to, you shoot me an email every time they do a service, or they spray the area, but then they stopped doing
Like,
that.
do you have to, the past 2 years, I signed my address up. Do you have to do it every year, or is that?
Do it every year,
Do
as
it
far
every
as I
year.
know. So like the aerial spraying, that's just strictly like the wetlands, so there's no reaching out for that. But once they start doing the ground spraying, you would reach out and let them
Yeah.
know that you have interest in it, and then they would spray.
Cool.
Yeah, I mean, we always remind everyone, it's, it dissipates, so it's one of those things, it's like a multi-prong approach. So even though your yard's being sprayed, you wanna make sure you have screens, you get rid of the standing water, you're wearing insect repellent, longer sleeves when you're outside.
It's cutting down the trees help.
Clean the gutters.
We cut down like 20 trees.
Did you?
After the
It'll
interview,
dry it out, so it dries things out.
after I saw it, when I went around my house, you should have seen the stuff he told me about. And I'm emptying all, like old barrels.
Just things that, that hold
and,
standing
you know,
water, for
top-
sure.
The top of a barrel in the backyard, like behind the garage.
Take long
It was
there.
amazing what I found.
Their cycle's pretty quick, though.
Yeah.
They'll start going.
Yeah. They do
All right.
bird park,
Should we
Melissa.
adjourn?
We
Yeah,
shall.
the pond,
We make a
that's it,
motion.
right?
Would you like to make a motion to adjourn?
Make a motion to
I
adjourn.
will second the motion. We hear a vote. Mona?
Aye.
Stefan?
Bye.
I also. We will adjourn the meeting.
Thank you.